Hey guys, I understand what it's like to work in a dental office. It's stressful. It's difficult to all get along. It's hard for us as hygienists to stay on time. It feels like we're running on a treadmill. And I know, doctors, that you want your hygiene department to be more productive. You want to see those patients keep their appointments. And I imagine you have hundreds of overdue patients that you don't even know haven't been to your office for the last 18 months. My name is Debbie Bitke. I'm a dental hygienist and I'm the CEO, founder of Dental Practice Solutions. And I am going to walk you through a specific training that I created, not only for your hygiene department, but I recommend and highly advise that you take this training and have the entire team work together so that you can create your own systems and work in harmony, feeling like you're getting through the day with yoga, not stress and running on a treadmill. So watch me as I go through this at this time. Hey guys, I wanted to share with you what it looks like inside the web portal when you log in. So once you pay, you will, within 72 hours, we try to get the credentials to you so you can log in as soon as possible, but I ask for some grace. Could be on a Friday that you registered, so give us till Monday or Tuesday, and we will email you your login credentials, and you will go to this link, and you use your email and a password, and you can always change your password. So we have an orientation. I do suggest, as I said earlier, that you take a team approach. A lot of times I know dentists say that they want their dental hygienists to have autonomy, and that does not mean that we don't support each other. And sometimes that gets misinterpreted, and I think it's very important that you work together as a team. And I think it's important that you have an implementer and somebody who can download these videos and download the scripts and everything. They're in charge of it. And you save this on a computer somewhere and even print out and put in a notebook. So when you first start the challenge, I recommend that you take a few days to prepare for the challenge, because you're going to actually measure. When you want to know if things are working, you want to look at the numbers. They tell a story. So I'm going to tell you what numbers to look at. One of the easiest areas to tap into to have a more productive hygiene department, super simple, is to reactivate hygiene patients. If you look at this one key performance indicator, you will see that you have at least 100 patients who have not been in over the last 18 months. And I'm going to show you simple ways to get them back on the schedule. If you need time and some help to strategize where to put these patients, please schedule a call with me once you're enrolled. I will meet with you and show you what to do, a strategy to get them back on the schedule. We can actually assess how many days you actually need a hygienist in the office and how many extra days or hours you might need if you're going to reactivate these patients. If you haven't invited them back, they aren't going to come back. It's the last thing on their mind to come to your dental office. So another thing that's super simple to do, and that is stop cleaning teeth. Hygienists, note to self, stop cleaning teeth. When your patient comes in, I'm going to walk you through a time management formula, and the first 5 to 15 minutes, you're collecting all the information. You are never scaling and polishing more than 20 minutes. In the very first 15, 20 minutes, you are assessing, is this a prophy patient? Does this patient have gingivitis? Is that gingivitis localized? Is it generalized, moderate to severe gingivitis? And what do we do? And I put a lot of information into this training on treating the gingivitis patient, because at this stage, we can put a halt to the disease in our patient's mouth. And we are in the business to help our patients live a longer, healthier life. When you take the time to deliver this message, your patients will not only feel like you really care about them, and there's a way that I'm going to share with you to say this to your patients so they understand we're not just trying to get money from them by doing more treatment, but we really care about their overarching health and that their mouth is connected to their body. I mean, you might be laughing, right? I mean, what a concept, but let's break it down into bite-sized pieces and help our patients understand their mouth is connected to their body. What happens in their mouth goes through their bloodstream and affects other parts of their body. Now, I've heard for many years, dentists tell me when they come to do the hygiene patient exam, it's crickets. And they also tell me that their hygienist never speaks to the patient about outstanding treatment or maybe a hole or an old discolored composite that they might see when they're scaling their patient's teeth or just examining the patient's teeth. So I'm going to walk you through things that you can say and do. A lot of this is subliminal. They're subliminal things that the hygienist is doing that gets patients to want what they need. So you have 3 weeks of different strategies that will boost productivity in the hygiene department. If you will work as a team, you will all work in harmony. If you implement these systems, you will not feel, or you should not feel, like you're working and running on a treadmill. So at the very end, there is a bonus. I see way too many patients calling last minute to cancel. And for years, I've created many different strategies to keep those patients on the schedule so they value what you do for them. So I hope to see you on the other side in the training. I also have a link. If you download the form to register, there is a link there. If you have questions, I'm willing to spend 15-20 minutes answering your questions. Hope to see you on the other side. Have a great week. Bye for now.